but we are just handing over to the implementers, which is the Shiselweni Reformed Church, Mfundisi. Let me start by probably giving you the background, the history of what's happening, why are we receiving this guy, and then hand over to the partner. We are getting requests from many of our partners on the programs that we are delivering. And then it varies, some funded in prevention and care support and home-based care. And the requests, they come almost like on daily basis. Our job as NERCHA is to ensure that we support our partners, mainly where we find their gaps. So in this particular case, we received the request from the Shiselweni Reformed Church, and then on home-based care. And then when we looked at Shiselweni, we found that in Shiselweni, there's a serious problem on the services that we're offering in Shiselweni. In actual fact, our service mapping exercise showed that Shiselweni, followed by Lubombo, is one of the regions that surely there are some gaps in terms of our services, mainly the home-based care. So we looked at your request, and we looked at the home-based care programs in Swaziland. The report that we've got, which is in the strategy, is that home-based care in Swaziland is still not very strong comparatively. We are at about 22%, those who need home-based care, which is the 18 to 59. Only 22% of those who need home-based care are in home-based care. So what it means, we've got people who are dying in isolation. We've got people who are dying without proper medication, which you normally call it palliative care, which is management of the pain, and somebody to die with dignity. So what it means is that we need to scale up. If 22% of the people are dying in such conditions, we need then to scale up to 50%. So that's when we said this is a proposal that we will support. We looked at the proposal, and then we looked for partners who can then assist us, because we normally do not have the funds available. Although people think NERCHA has so much money, we do not have such money that when we get emergency requests, we can easily support. So we wrote to our partners, we consulted our partners, and I wanted to thank the bank for coming in. Then the bank responded positively to say, let's look at the request close and let's discuss. So on your behalf, we're your broker. So went in there, we discussed with the bank the needs, because we don't just want to give people because they've just requested. Is any need on the ground? And then of course you responded, and which we really appreciated. Coming to private sector response to HIV, we appreciate the bank. It's not the first time that we have had such support from the bank. From our cooperation global and so forth, we need to work very closely with the private sector. So the bank actually has shown what I would normally say is a panacea, sort of like a leeway to say this is how we can work with private sector. One, private sector to understand the problems that we're facing on the ground, and two, for the private sector to understand that for HIV/AIDS in Swaziland, it is coordinated. There's a body that coordinates. So then to say if NERCHA is agreeable and NERCHA is saying that there is a problem on the ground and these partners can respond, we will support. And the bank responded to say, well, if we have looked at all the requests and all the procedures, the mechanisms on the ground, they responded. So given that, we then said we'll receive this vehicle on your behalf, and we really appreciate and thank the bank. And then from there, as a conduit, we just take the car and then hand over to you. Mainly, this vehicle is for the home-based care services. So, but it's surely to appreciate this partnership we have from a CBO chapter, which is the bank. Let me pause here, and then I will hand over to you, MD.
Right. Good afternoon to you all, and whilst it's a cold and rainy day outside, we at FNB are delighted to once again be involved in the sponsorship of HIV and AIDS-related projects in the country through our Corporate Social Investment Fund. Just a little bit of background about FNB's Social Investment Fund. FNB allocates up to 1% of its after-tax profits, and this is funded annually. It is a fund through which the bank seeks to give back to the community, and I think that's very important, that we give back to the community through sponsoring various projects ranging from community care, children's home, neighbouring care points, job creation, skills training, support and general welfare organisations providing support to the homeless and destitute, just to mention a few. the Shiselweni home-based care project that has brought us here today was introduced to us by NERCHA, as you heard. They are based in Shiselweni, which is one of the most poverty-stricken regions of the area. Their good work involves caring for, and I had here 1,500 people, but Dr. Van Wijngaard has just informed me that since the application came in, that has grown to 2,500. Absolutely fantastic. These people, and he's got 500, I think that's also grown from 500 to 663, I think he said, volunteers who go out there and help people and receive nothing in return but just the goodness of doing this work. They also feed approximately 70 orphans daily and running a preschool which is attended to by orphans and vulnerable children. The purpose of them acquiring this vehicle is in order for the organisation to increase their capacity through training of more caregivers group, ongoing training of existing caregiver groups, and weekly debriefing sessions for caregivers as a stress management strategy. And overall, to increase the ability to assist people who would otherwise live and die in undignified circumstances. We believe that the contribution we are making today will go a long way in assisting those who are ill and unable to travel to health facilities, particularly in the Shiselweni region. Shiselweni, a reformed home-based care, requested a vehicle from NERCHA, and when we as FNB were approached by NERCHA, who, as you're aware, is a national key player as far as response to HIV and AIDS is concerned, we gladly accepted. Hence this presentation today. To the committed individuals behind this good cause, congratulations and thank you from the entire staff of FNB for the good work that you are doing. We would really like you to urge you to uphold the high standards of accountability and responsibility at all times. I have no doubt that this vehicle will have a positive impact on a large number of people's lives, starting from now. Ladies and gentlemen, the Board of Directors, through its Corporate Social Responsibility Programme, have pleasure in presenting this vehicle, a contribution which values in excess of 222,000 Imalangeni. But again, thank you very, very